I was away for about a week and a half, and I know right before I left, Rhett says, hey, this is about how, and Pinder, you'd be able to elaborate. Hey, we should do that heart fit thing. And I don't, like, it kind of just, yeah, sure, whatever, yeah. And no idea what it is or anything. And then I get a phone call, hey, we should do that heart fit thing. It's like, yeah, no, I heard you say that. And then Kirsch is like, yeah, we're going to do the heart fit thing. I'm like, I don't know what that is. Well, Rhett wants to do it. Okay, well, what is it? I don't need to talk to Rhett. So that's about where I am, although we are going to learn a lot more about it right now. As join in studio, the heart fit, we'll get you up on the microphone here. Sorry to do this to you. It's very, all right. It's one of those mornings.
You ready to go?
I'm ready to go.
Who do we have here? It's Diamond?
Yeah, Diamond Fernandes.
Diamond Fernandes is here from the Heart Fit Clinic. And now, Rhett is a bit of a worrier. He won't admit to it, but...
Don't worry, I'm proactive in my health.
If there's a little ache or pain, he worries. Oh, geez, is that...
Got a tweak.
Got a tweak. Is that... Am I having a stroke? Like, just little things.
You're sniffling.
My arms are always numb, so you never know. Something could be happening.
So for you, Warner, how did you hear about this, and how did you search it out?
Advertise on the show.
Right.
Yeah. Hear them advertising. I'm like, little chest pain.
Of course, yeah.
Be proactive. Now part of it is that you're saying you can predict within the next 5 years.
Yeah, I mean, obviously everyone is healthy before a heart attack. I don't know anyone that says, oh, I shouldn't have had that burger last night. It doesn't work really that way. So, and the point is that we have the most accurate test to see where your risk is of a heart attack or stroke. So it's a lot different than going to your family doctor and just getting your cholesterol done, because the majority of people that have normal cholesterol actually can have heart disease. So when you go to the hospital and people are sitting there with heart attacks, actually the majority of them actually have normal cholesterol. So it's more than just cholesterol. Yeah.
Because you go to your regular doctor, and it's not an indictment on them. Yeah. No. It's like, oh, we're going to send you
it's an important first step.
Get some blood work. Yeah. So they give you the sheet, and then you go and you book it, and you sit there and you wait for 4 hours before you gain, and then they bring you in, they take some blood, and then it's like you find out from your doctor about a week later what's going on. Yeah. How is this different? Like, what's the procedure? Can anybody just...
Yeah, so we don't require a doctor's referral to come into our clinic and do our assessments. So it's a really bridging the gap in our healthcare system. I think we're really good. I think we got some of the best cardiologists in the city to deal with a problem if you're actually having a heart attack or a heart problem. But there's a big gap between that and your family doctor. So even if you go see a cardiologist on a preventative level to see where your risk is of a heart attack, many people out there have heard, I ran on an exercise treadmill and they got me to my maximum and my doctor told me, hey, I'm okay. But the problem with that test is that it'll only show advanced stages of a disease. And if you think about an artery, it's like the majority of heart attacks actually occur with blockages that are less than 50%. Yeah. So the doctors are good at seeing if you have a blockage at 80 or 90%, but the majority of heart attacks happen below that. It's kind of like that pimple on your face that explodes. If that happens inside your artery, that's danger.
Now
there's three different levels too of tests that you guys do, right? Absolutely. I went for the full. Give me it all. Shockingly,
yeah. I mean, people, and it's important. I mean, if you have high blood pressure, for example, many times you go see your doctor, they'll give you a blood pressure pill. With our clinic, we want to see, well, why do you have high blood pressure? Do you have something that's out of whack or something like that? So, even if you have high cholesterol, many people are taking a cholesterol-lowering medication on a prevention basis, and it's worse than going to the roulette table and trying to see how that is. And no one really wants to gamble with medications that way in terms of trying to see. It's called the number needed to treat. How many people like you need to walk into a doctor's office for one person to benefit from taking that drug? And on a preventative level, it's really bad. So there's a lot more to see what's going on.
That's the key with you. Yeah. The whole thing, isn't it?
Yeah.
Preventative.
Absolutely. And so
now you do stuff after people have struggled.
Yeah. And you saw that there were people in the clinic that were there because they've already had a heart problem, and we got some really great treatment options to grow new arteries and improve heart function and artery function. So that's those beds that you saw pumping away there. So
is there any way in layman's terms to tell us how this is different than a cardiologist, or what these tests so advanced that allow you to see these things more more in advance than anything. Is there any way to tell us how this works or what kind
of? Even if you went to see a cardiologist on a preventative basis, they're only doing testing to see if you have advanced stages of a disease. Right. So, like I said, the majority of heart attacks and strokes actually occur with blockages that are less than 50%.
Yeah. So how do you see it?
So we do that by blood work. We do artery screenings and function testing.
Did the ultrasound right on my neck.
Yeah. So new science.
Yeah. So we got some, and the PULS Cardiac test, which many people have heard about now, is so it's looking for protein unstable lesion signature. So basically, what that means in layman's term is we're looking for unstable pimples inside your arteries.
Right.
And so we're the only people that do it. Yeah. And so going to your cardiologist, they're looking for too far out. And so many times people are walking away with a clean bill of health. And there's new literature now that, heart stents, putting in heart stents on people that are stable, meaning that are not having a heart attack, there's no benefit to that.
So who should be listening right now and say, okay, maybe is it I've had a chest pain, I need to go, or I just turned 40, so I should go? Like who's...
Yeah, I think anyone who is concerned about their heart health, so someone who has a family history of heart disease, or someone like Warner who's come in and says, okay, well, I really just want to know where I'm at.
It's just a delicate worry
it's
word.
important because, well, it's important.
Be proactive.
Yeah.
No, you're right.
I mean, ignorance is not bliss, right?
Yeah,
and so, like I said, everyone is always healthy before a heart attack. And if you're lucky to survive one, that's the most important part. And I mean, you're not really doing it for yourself. I mean, if you got young family and wife and whatnot, you want to make sure that you're at your best to make sure that you don't have a concern or problem in the future. So, and those people who have high cholesterol, or diabetes or family history of heart disease, or someone who just even does have heart disease, that's what we do. We focus on really doing the best preventative screening tests to see where your risk is of a heart attack or stroke. And then more importantly, reversing that process, which is the more fun part.
So for someone who is on, like you mentioned, cholesterol lowering medication, you would think, okay, well, I'm taking meds for it. It's fine.
Yeah.
But
no,
that's not the case.
Not at all.
So explain the dangers that even though your cholesterol is lower because of the medications, this exists.
In my opinion, I think we got it all wrong. And I'm saying this a little bit bold, but we've got a lot of literature now to show that we can get statin medications. Everyone's heard about cholesterol-lowering medications like statins. There are these new injectable medications that we can lower cholesterol like 75% lower than where it ever was. And so we're basically taking cholesterol off the table with these injectable drugs. And the problem with that is that we're still having heart attacks and strokes. You only reduce, so I'm going to get a little scientific here, but if you lower your cholesterol by 75%, which is ridiculous, right? I mean, you're just cutting your risk by a quarter. You actually only reduce your risk. So you lower your risk by 75%, but you only actually reduce your risk of a heart attack or stroke by like 1 or 2% max. And so it's more than cholesterol is my point. And it's
not as simple as saying, your cholesterol's high and your blood pressure's high. You're in trouble. Here's some drugs.
I had someone, which was horrible for me to do, but I had someone who was smoking, came in the clinic, said, I know I'm at risk. But I had to tell him, look, you're actually not so bad. Where we had someone who's super healthy, plays hockey, and everyone's heard about the hockey heart attack, and I got a friend that had a heart attack. Well, it's that pimple exploding inside an artery, and if you don't get checked, it's always a important thing. I think we're doing the over 55 tournament next week, I think, as well. So it's just important to kind of see, it's just way more beyond cholesterol. It's about inflammation and understanding where your risk is of a heart attack or stroke that way.
So Retro, tell us about, you went in.
So I'd heard the ads, and because I'd not heard of the Heart Fit Clinic until the ads came on, and I was just like, you know what? And I am proactive in my health.
You are.
We bug each other, but I am believing that if you're proactive, you can influence the rest of your life.
Absolutely, yeah.
Instead of waiting for something to happen, get ahead of it. And that was my whole approach. I wasn't feeling great. I said, you know what? To heck with it. I'm going to go in. I called them. They got me in quick. There was 3 different levels of I don't know what you want.
Yeah, there are 3 different levels of assessments that we kind of do. And
I went full bore. I said, give it to all. I might as well know it all, and we can go from there. So I'm going in next Monday to have all the blood work and the results and have my chit chat. But it was great. The stress test, they did the ultrasound on my neck, which, I mean, my explanation of it isn't as in depth as Diamond's, but
it's important to understand, like, so all the blood work that he hasn't had yet, that we're going to go over on Monday with our nurses there. So it's way more in depth than what you can get at your family doctor's office, way more in depth that we can get in our healthcare system. The real reason why we're around is to really bridge an important gap in our healthcare system. So when you go to your family doctor, I mean, we've been doing this for a long time, and how many people that we see who have already had a heart attack saying, well, I went to my family doctor and I had a clean bill of health. Why am I here with a heart attack now? And that's the reason. It's way more beyond what a family doctor can do. And even if you go see a cardiologist, like I said, on a preventative level, they'll do a stress test. And a stress test is only designed to show advanced stages of a disease. What I mean by that is that if you look at down an artery's got to be like significantly blocked, like 80, 90% before it starts to show up on that test.
Gotcha.
Right? And so there's what happens between 0 and 80. That's the most important part. And like I said, the majority of heart attacks occur below that.
and you can influence it.
Absolutely.
And that's the
Well,
thing.
and that's what my last question was going to be.
Yeah.
So we find Rhett goes in for a test. It's like, geez, there's a bit of a red flag here.
Yeah.
Is it medication? Is it lifestyle change? Like, how do you then
Yeah.
go if there's a problem addressing it?
So if there's a problem, I mean, Rhett did the whole 9 yards with us in terms of we can go right in depth into understanding, okay, well, where is he deficient? You know, what deficiencies does he have in his blood that we can replenish? And so it could be as simple as maybe giving him some supplements to kind of push him back up to an adequate level rather than being in a deficient level. Not saying you're there yet. I haven't seen your results yet. So
I can't wait.
but that's the cool part. And then, you know, we obviously focus a lot on natural treatment options, obviously focusing on exercise and nutrition and supplements and stress management. But then we also have external counterpulsation therapy, which is a treatment where patients lie on this bed and it pumps blood back up to the heart muscle, and it basically grows new arteries and improves heart function. So see amazing benefits with that part of it. And that's more for our higher risk or those people that do have heart disease, especially those that have hypertension, which is high blood pressure, or diabetes, or actually heart disease itself.
So where, how? Website, where are you located? Give us the...
HeartFit Clinic is heartfit.ca.
Okay.
Phone number is 403-870-4348. Don't call it that often, so I always had to think about that one.
I was going to say, don't bother calling. Heartfit.ca.
Heartfit.ca, yeah. We're really good. I mean, we got a great team of staff there to help you out and really take you through the rigmarole. And, you know, it's amazing. I mean, yeah, and, you know, people are always scared to kind of know, like, oh, you know I'm overweight. I know I'm this. I'm going to be at risk. Well, it's better to know how much, so you know what you got to do to reverse it. Like, you know, we're going to tell you one of three things.
Don't let fear push it off.
No, it's way more, and it's not really about yourself. You got to almost take an unselfish standpoint here and say, okay, well, I got a family of 3 boys, and, you know, I got a wife, and what happens if I'm gone tomorrow, right? And, you know, and if I'd known, I could do something about it to make sure I reverse that process of it. So, you know, basically you're going to come in and we're going to tell you 3 things. Either one, we're going to give you peace of mind, tell you, look, you're okay, everything's not a problem, or we're going to be in a borderline zone that we need to kind of address some small things here and get fixed up a bit here. But this is a reversible disease, right? You can reverse the process of it. You don't have to go. We're not going to give you something that's written in stone and say, hey, this is where you're going to be. You know, it doesn't work that way. Or lastly, we're going to tell you, look, you're really at risk, and we got to get aggressive at reversing this risk. But it is all reversible. You don't have to. Like, if I told you, you know, you're on the path of a heart attack or stroke, you're going to start to do some things differently. You're going to start to think about it, not in a worry way, but now being proactive. It's just like saving for retirement, you know? Mm-hmm. If you're putting money away to save for a house or save for a car or save for retirement, it's small baby steps in the right direction where you start to see a reversal of that
So
process.
are you guys are you regarded as like this renegade group of heart fit people? Like, are the family doctors like, what are these guys doing? Like, they're just...
Yeah, it's sometimes, but
right?
You know, the family doctors that know about us refer to us because they know that they're missing this gap. They understand that, look, I'm checking your cholesterol and putting you into what we call a Framingham heart score, which is basically a coin flip to tell you, oh, I think you're at risk or you're not at risk. And if you are at risk, I don't know really what I can do for you, but other than give you pills. And so we're an important gap. And the doctors that understand what we do refer to the HeartFit Clinic. That's just the way it is.